Hello, my name is Masoomeh. This is the presentation for Group 6. The subject is about mental health in prisons. Mental health disorders are occurring at a high rate in all countries over the world, and they are specifically much more prevalent in the prison population. And there are several reasons for that, such as the misconception that all people with mental disorders are a danger to the public, the intolerance of societies to disturbing behaviors, the poor access to mental health services such as treatment, care, and rehabilitation of these people, the stress of imprisonment, and also the human rights violations such as the torturing of the people with mental health problems in prison. The factors which have negative effects on mental health in prisons are such as the overcrowding of the environment in prisons, various forms of violence, enforced solitude or lack of privacy, isolation from social networks, insecurity about the future prospects in terms of their jobs, relationships, inadequate health services, and using prisons as the places where they send the people with mental health problems to them rather than sending them to the mental health services, and also the stigma and discrimination which are against the people with these disorders. What are the benefits of responding to mental health issues in prisons? Um, the benefits of mental health issues services can affect prisoners, prison employees, and also the community in total. For prisoners, it can reduce the stigma and discrimination. It can improve the possibility of their adjustment to the community life when they're leaving the prison, and also it will reduce the return to prison. About the prison staff, the working environment in prisons are very demanding. So when the mental health issues are addressed in the prisons, it will be definitely increase the moral and mental health of the employees as well. And in the community, it can reduce the incidence of reoffending or returning to prisons. It can improve the treatment and rehabilitation of people with mental health issues. And also, it can reduce the costs of prisons. So, a good prison management and also a good public health should include several goals. These goals are the detection, prevention, proper treatment, and promotion of good mental health. In order to achieve these goals, there are some strategies. What are they? To divert the people with mental health issues toward the mental health system, to provide an access for mental health treatment and care, to make sure that psychosocial support and psychiatric medications are available for the people with mental health disorders as much as they're available for the general public. Also, to provide training to staffs in prisons, especially to giving education about the detection, recognition, and prevention of suicide among people with mental health issues in prisons. And also to provide education to prisoners and their families so that they're informed that when and how they can seek help when they have a mental issue. And also to make sure that there is a collaboration between all organizations and sectors that can make proper legislation, proper resources to address the mental health issues. Thank you.
There are significant challenges facing people with mental health issues who are justice involved. One of them is social determinant of health and the criminal justice system. Some social factors that influence on health outcomes and inequities are poverty, unemployment, low education attainment, and inadequate housing. All of them are influenced by global factors such the economy, healthcare system, and the social safety net. Therefore, individuals with mental health issues from marginalized or second important communities and Aboriginal people, regardless of their innocence, have greater likelihood becoming involved in the criminal justice system, to be held in detention, to be convicted of their charges, conflict with the law due to self-medicate with alcohol or illicit drug, due to lack of early identification and intervention for their undiagnosed mental health illness and developmental disabilities. Another critical challenges facing people with mental health issues who involved with justice system is some strict bail conditions imposed by court on people with mental health issues. Some bail conditions with targeting an accused person's mental health are to seek treatment or detox, to abstain from alcohol or drugs, to reside at certain facilities or shelter. In fact, the criminal justice system with such strict bail conditions often lead to further criminalization. According to recent John Howard Society Ontario's studies, in a population of persons under bail supervisions, 70% of the clients had issues with substance with alcohol or drugs, over 40% had current mental health issues, 31% had concurring mental health and substance use issues, 1/3 being homeless. Criminal justice system inadvertently criminalizes mental health issues with the above bail conditions, and they were found to be correlated with future failure to comply charges. Therefore, people with mental health from marginalized communities and Aboriginal population are more likelihood invited to breach or fail to comply with the imposed bail conditions by court. As a result, a cycle of recharging, rearrest, and reincarceration is observed among them.
The third key challenges facing people with mental health issues who are justice involved is the impact of incarceration on mental health. A. Access to treatment and medication in jail. Many people in provincial jails are not provided with proper medication or psychiatric assessments and treatments. Continuity of individuals' medication is a significant issue. Individuals are frequently incarcerated without their medication and have to sometimes wait weeks to get access to medication that they were accustomed to taking daily. There also exists a serious lack of timely and meaningful programming and counseling in relation to addictions, mental health, relapse prevention treatment, and harm reduction in correctional institutions. All of these challenges are more pronounced for prisoners with mental health issues who are awaiting trial. Access to treatment for this population is very limited. B. Segregation, overcrowding, and mental health. Humans are social beings. Research has shown that prolonged periods of isolation can cause a variety of negative physical and mental effects, such as hallucinations, cognitive disabilities, insomnia, self-mutilation, paranoia, and suicidal tendencies. Segregation is especially damaging for those with pre-existing mental health issues, as it can aggravate or lead to other psychiatric symptoms. Broadly speaking, segregation is used to maintain the security of the institution or to discipline misconduct. Segregation units are very different from the general population units. Prisoners are locked in isolations in their cells for 23 hours a day without programming or privileges. Incarceration in general deteriorates mental health, and the practice of segregation has far more deleterious effects, particularly for those with pre-existing mental health issues. Provincial jails have been overcrowded for years. 2 or 3 prisoners often sleep in cells designed for 1. Prisoners do not generally cope with overcrowding. However, for persons with mental health issues, the impact is far more pronounced and creates risk for the most vulnerable prisoners. Studies show that remanded populations commit suicide and self-harm, almost always while in isolation. at higher rates compared to sentenced populations. The provincial government of Ontario recently pronounced it will be undertaking a review of its policy on the use of segregation. C. Loss of housing and income when incarcerated. Housing is critically important for people with mental health issues. As noted in the Ministry of Health and Long-Term Care's mental health strategy, Open Minds, Healthy Minds, safe housing and stable employment are crucial for the mental health and well-being of all Ontarians. If we have means of supporting ourselves in a place to call home, we are more likely to be able to cope. If charged with a criminal offense and detailed in jail, individuals are not able to attend work, and those receiving social assistance benefits are cut off or suspended. As noted, loss of housing and personal effects presents a significant problems for individuals with mental health issues. Housing is a key to stability and recovery. Studies show that many individuals who had housing when initially incarcerated end up homeless upon release from prison. Inadequate discharge planning in Ontario's correctional institutions often results in individuals being released to no fixed address, with inadequate clothing and no psychotropic medications. This creates a cyclic effect of recidivism and a sense of hopelessness. Fourth, stigma. Once a person with mental health issues becomes involved in criminal justice system, there appears to be less concern regarding the stigmatization of individual. The provincial government recently committed to regulating and standardizing what information can be disclosed on police record checks in Ontario. In particular, around the disclosure of non-conviction information, which is a positive step forward. There are no human rights protection in Ontario for those people who are denied employment opportunities on the basis of a record criminal convictions or non-conviction information, such as pending charges or withdrawn charges. Research has clearly shown that barriers as a criminal record creates are significant and are especially pronounced for marginalized populations such as those with mental health issues. Fifth, service and funding silos. Since most justice-involved individuals with mental health issues do not get streamed through the forensic mental health system, many of them begin their rehabilitative journey by walking through the doors of community criminal justice organization or CCGOs. Services offered by CCGOs often target the social determinants of health and prevent health crises for individuals with mental health issues who are justice involved, and where available, connect them to the clinical care that they need. CCJOs are important partners in serving justice-involved individuals with mental health issues. In moving forward, it is recommended that CCJOs be recognized as important partners in the community-based provisions of mental health services.
Moving towards decriminalization, adopt and apply an inclusive definition of mental health. Mental health is not simply the absence of signs or symptoms of mental illness or addictions. This is to ensure that all Ontarians with mental health issues are being treated appropriately and sensitively. Second, invest in prevention, create a proactive and accessible mental health care system. Families who suspect their loved ones are exhibiting early signs of mental health issues should have access to information, services, and treatment options in the community. An example of this one is building a mental health infrastructure. Consistent with the recommendations of the report to the legislature by the Select Committee on Mental Health and Addictions, as well as the provincial government's 10-year mental health strategy. These endorse the recommendation that a core basket of evidence-based mental health care services be available in all communities in Ontario for children, youth, families, and adults. These core services should be inclusive of the range of service noted above, from prevention, intervention to recovery. We further endorse the Select Committee recommendation calling for system navigators who can help individuals and their families access appropriate treatment and community support services. In addition to system navigation, assistance family members need meaningful access to crisis intervention, respite, and counseling services. Third, target the social determinants of health. First is poverty and income. Poverty reduction strategies must aim to ensure adequate social assistance incomes, social housing initiatives, and quality early childhood education programs, particularly for vulnerable communities. Improve the accessibility and structure and allowance rates of social assistance as per the Social Assistance Review Commission's recommendations. Recently, the provincial government raised the minimum wage in Ontario to $11 per hour. It further announced that the minimum wage will increase to $11.25 per hour for general employees effective October 2015, and that increase will be tied to inflation, which is very encouraging. Next is the employment and volunteer opportunities. Develop a comprehensive strategy informing investment in evidence based programs to ensure that marginalized young Ontarians, including these with criminal records, have the opportunity to develop the life skills, attain education and training, and acquire meaningful work and volunteer experience. Regulate the current employer demand for police record checks during hiring process. Next, determinant is the homelessness prevention and housing first funding. Implement an eviction prevention strategy for people on remand at the provincial level. The goal for this program should be to prevent loss of housing for people entering custodial facilities for short-term periods and prior to sentencing. Expand proven housing first 46 models with designated beds for those with serious mental illness to more communities in Ontario. Um, Fund a housing program that ensures the number of affordable housing units meets the demand. Monitor and reduce the percentage of Ontario tenants spending 30% or more of income housing. Fund additional rent geared to income and supportive housing for low-income individuals who have mental health issues, and provide individuals with mental health issues secure placement in supportive housing immediately upon release from custody to promote a more positive, successful reintegration into the community.
Hi, my name is Eunice Reyes from Group 6, and I'm going to be talking about the continuation of key recommendation to moving forwards decriminalization. So the fourth one is to recognize community criminal justice organization as key mental health partners. Of course, you have to invest, establish core funding streams, establish protocols, and ensure adequate representation. So the fifth one is to invest in the creation of criminal justice community that can respond appropriately to people with mental health issues. So community and mental health system should come hand in hand with criminal justice community to deal with people with mental health illness. So community mental health system identifies and effectively treats people and individuals with mental health issues, while criminal justice community recognizes punitive responses to people with mental health issues that have not been effective. So the criminal justice system must also strike a fine balance. It must respond appropriately and humanely to people with mental health issues while being cautious not to further entrench itself as a key entry point to healthcare for those in need. So here are the recommendations that aims to shift the current criminal justice system response with mental health issues. First one is to examine alternative response to drug use in Canada. Next is to expand the capacity of pre-charge and post-charge diversion program to divert people with mental health issues out of the criminal justice system. Next is to reduce the large remand population and overcrowding in Ontario's provincial jails by meaningfully addressing bail in Ontario. And next is to the Ministry of Attorney General should consider expanding the availability and capacity of bail verification and supervision programs in Ontario, and also fund clinical counseling program and maintain youth justice system that emphasizes non-custodial responses. Next is to increase the investment in community-based youth programs and commit to funding and expansion of specialized courts. And last is to continue to improve access to legal representation for low-income Ontarians through ongoing investment in Legal Ad Ontario. The sixth part is to foster effective and humane correction. So given the prevalence of individuals behind bars who have mental health issues, we make the following recommendation for their humane treatment. Number one is to standardized and validated mental health assessment. Next is to screen individual for homelessness risk upon entry and release, and then avoid mental illness segregation. Next is to fulfill obligation outlined in the public interest remedies, and last one is to ensure the provision of quality round-the-clock access to medical and psychiatric care in prisons.
Good afternoon, everybody. My name is Abdulnasir Abamecha. I am going to present about reintegration and destigmatization of prison population, and finally, I would like to conclude mental health issues in prison population. The first step of reintegration is planning, and planning should be started as soon as the prisoners are admitted to correctional institution, regardless of their sentence length or sentence status. Arranging housing, mental health treatment, employment, and other service before they released. Building a system of parole that reflects the importance of gradual release in effective reintegration. Protecting the social housing eligibility is another important factor, and the community health nurse should investigate rent supplement that enable the remanded prisoners to attain housing. The other one is fund crisis or inpatient psychiatric beds, and individuals in crisis or ordered for treatment as a condition of probation. The second step is destigmatization of mental health. And in this particular point, families, individuals, and communities need better information and education about mental health issues, the criminal justice system, and how these issues can intersect. Education is critical for combating the stigma surrounding mental health issues. Individuals should not be banned from access to housing on the basis of a police record or past criminal justice involvement. Housing is important for quick recovery from mental illness, and protecting Ontarians against discrimination on the basis of any record of offenses is really important. Finally, I would like to conclude mental health issues in prison population. Ontario cannot afford to continue down the costly path of criminalizing mental illness. Early symptom identification and treatment of individuals with mental illness should be exercised instead of using the criminal justice system as a catch-all. Proper prevention requires the availability of and access to clinical and community-based mental health care. Social determinants of health should be properly addressed. Effective prevention also requires a criminal justice community that responds to people with mental issues. Individuals with serious mental illness should never be placed in segregation. Protecting educational effort is critical for shaping both public and service agencies' responses. Thank you very much for your attention.